response to COVID-19. This is a question and answer program with Ames area organizations who are responding to COVID-19 questions that we've received. I'm Susan Guialsa, Public Relations Officer with the City of Ames. We have several questions that have come in this week, and we have several guests available to respond to those questions. If you have a COVID-19 related question, make sure to contact us. We have an Ames hotline that is staffed Monday through Friday, 8 to 5 at 239-5670. You can also send us an email on our COVID-19@cityofames.org email address. Again, COVID-19@cityofames.org. And we'll try to get to your question on our next show. Well, let's get to our panel and get some questions answered. Our first question goes to Geerly Medical Center, and we have Steve Sullivan on our panel to answer this one. Question number 1. I'm worried that a hospital the size of Geerly Medical Center could be overwhelmed by a surge of COVID cases. How do we know that we're prepared?
Well, based on current projections, we don't anticipate being overwhelmed. We've been preparing for the potential of a surge of patients for a number of weeks. Geerly has 185 inpatient beds. Now, that doesn't mean all those beds would be put into use for COVID-19 patients. Our OB unit, for example, is part of that count, and it's very busy because people, despite everything, are still having babies. We do have an area of our inpatient unit that is designated for COVID-19. That's about 50 beds right there, including some rooms that we weren't using for inpatient, but have been re-equipped should we have a surge of patients. We also have a 14-bed ICU unit that would be utilized and is being utilized to treat patients. And we have other areas of the hospital that, due to our lower census, could be pulled into play should we need them. Again, we don't anticipate having to go beyond the capacity of the hospital, but we are preparing for that potential, as slim as it might be based on current projections. And we are speaking with our community partners about how we can deal with that situation should it come up. And of course, the most obvious, of course, is the university. But there's no rock solid plans there yet. There's a lot of discussion going on. So all things are being considered.
Thanks, Steve. And again, thanks for reiterating the collaborative spirit that we have here at in the Ames community, that all of our entities talk often, communicate with one another, and look for ways to help out when possible. Second question that is, I think, Geerly related is how is Geerly changing the way it provides services both to protect patients and staff?
There are a number of things we've done over the past several weeks. The most obvious one, of course, is visitor restrictions. And those have changed as the situation has changed. So right now we have a no visitor policy. There are a few exceptions to that. For example, if you're in our very busy OB unit, you will have a support person with you. We are screening everyone who comes into the hospital, people who are coming in. This goes for staff, physicians, visitors who are allowed. Are being given a cloth mask to wear. We have to wear that in public places and patient areas of the hospital. Clinical staff are wearing procedure masks at all times. The rest of us are wearing cloth masks, which have been created by an army of volunteers throughout the community, and we are just in their debt for this. This has been an amazing service, and we're still relying on it. So everybody's masking. So in COVID patient rooms, we have put things in place. So we only have essential staff going into those rooms. The best example I can give you of what that means is typically if you order a meal and you're a patient and you order a meal, a member of the dietary staff is going to bring that up to the floor and bring that into your room and get it all ready for you. And they're going to come back and pick up your tray when you're done. That's not happening anymore. You may order a meal, of course, but it's going to be brought in by a nurse who's been assigned to you. So it's a small core group of people who are all properly PPE, who are going into the patient rooms, COVID-19 patient rooms, both diagnosed and those whose tests we're still waiting on. We've, of course, canceled elective surgeries, which is a variety of reasons for that. One of the key ones, of course, is to preserve PPE. That is a big thing, of course, for any medical center right now. Restaurants being closed affected our cafeteria. We're still serving food. Coffee shops still serving coffee. It is all takeout. We're also using telemedicine more frequently than we would have typically in as many areas as we can. Pain clinic and wound clinic are two examples.
Thank you. Great and very thorough response. Next question, I think I'm going to kick over to Ames Police Commander Jason Tuttle to explain the state and local directives, what they are in regards to playgrounds and green space. And I'm especially concerned about people gathering as we head into nicer weather. Is that a concern?
It is. We saw an increase in complaints on this last week when it warmed up to 80 degrees in some of our parks areas around town. So any gatherings need to be limited to 10 or fewer people. If anywhere you go throughout the city, whether it's in a business or outside. Also, many of our playground structures in city parks and schools around the area, those areas are closed. However, the green spaces and the trails in those areas are still open and people can use those. We did receive quite a few complaints last week, and most of those complaints that we received were actually not violations of the governor's proclamation. It was just 2 or 3 kids playing soccer out in a green space in the city park. Point that still is allowed to happen. And so I think as the night weather increases, we may get some more of these phone calls. We're trying to balance the need to respond to those calls with other priority calls that we may have that may come in. So we'll eventually get to those. But at this point, those are the main complaints we've seen come in so far.
So thanks for that clarification. However, if somebody does notice a very large gathering of people or has concerns about something they do feel is in violation of those directives, what should they do?
Yeah, for sure. One thing they can do is call our dispatch center. That number is 239-5133. I think for those situations, probably some more of the certainly egregious offenses. If you see a large party of college-age kids in a front yard, there's 10 or more people there. They're within 6 feet of each other. That's something that you should call us about, and we'll respond to those. There's some other things. If you see some people in a parks area and you're not sure, you could also call the Parks and Rec Department during regular business hours, and they may be able to respond to that so that we're not dedicated police officers potentially to respond to that call. So there are other ways to report that. As you said earlier, Susan, we have the city hotline Monday through Friday they can call into. And again, that number is 239-5670. And also COVID-19 at cityofames.org is another way that they could report that by email.
Thanks, Jason. We have another medical question. I'm going to kick that over to Shelly Jakey with McFarland Clinic. Shelly, what if I am a person with other health concerns? Can I still see my doctor? And is it safe to come to the clinic?
Absolutely. Thanks, Susan, for asking that question. I know that's on the minds of lots of residents in our area, and we want the residents to know that if and when they need care, McFarland Clinic is a safe place to receive that care. Just as Stephen mentioned with the hospital, McFarland Clinic, we put in a number of steps to ensure the safety and care of our patients. For example, we do have a nurse phone line that individuals can call directly to be able to assess perhaps some symptoms, upper respiratory symptoms that they're having, and determine where best they might need to get care for that. Or do they need to go into their doctor's office? We also have designated clinics here in Ames and in a couple of our other communities for individuals who are having upper respiratory symptoms. One of the reasons why we've put those clinics into place is that we can consolidate and conserve our PPE at one location and treat individuals with those symptoms while keeping some of our other clinics open, certainly, to provide care to patients who may have other healthcare concerns. So between the nurse phone line, the designated clinics, and certainly, just as the hospital is doing, we're screening individuals that are coming to the clinic for symptoms. We've limited visitors as well at the clinic. But McFarland Clinic is a safe place to receive care. You know, individuals have healthcare needs beyond some of the symptoms associated with COVID, some that are chronic care health issues. And we want to make sure that patients are receiving the care they need. So we would encourage anyone who has any sort of healthcare concern to give their provider a call or in the clinic a call to be able to discuss these. And be able to determine what are going to be the best options for receiving care. It may in fact be on site at the clinic. It may be utilizing some of our new telehealth services, being able to talk with a provider via the phone or through a video visit. So again, we just encourage folks that have concerns to give us a call, and we're here to provide that care.
That kind of leads us into the next question I'm going to throw to you as well is, if you're having symptoms and you don't know if it's COVID-19 related, what is the course of action you should take?
Yeah, absolutely, giving us a call. And I'll provide the number to the nurse phone line. It is a team of nurses on there. They're able to take your call and do some assessment with you. That number is 515-500-6711. You can call that number directly, or you can call into your primary care office directly and visit with the staff there as well. And again, they will assess the symptoms, what you might be experiencing. There's a variety of screening questions, protocol questions we ask to determine where best to direct you for care.
Great, Geerly, thanks a lot. And I want to thank all of our panels of guests today, Steve Sullivan with Geerly Medical Center, Jason Tuttle with the Ames Police Department, and Geerly with McFarland Clinic. Ames responds to COVID-19 as an opportunity for Ames residents to ask their COVID-19 questions. If there's something you're curious about, please let us know. We'll put together another program soon, and we'd like to include your question as part of that. Again, call us with your questions on the city hotline, 515-239-5670, or email us at covid19@cityofames.org. Finally, please remember that we are living in rapidly changing times. The information we provide today is the most accurate that we have today, but everything may change. Please continue to check reliable sources for information, including our City of Ames website at cityofames.org/COVID-19, no hyphen. Again, thank you for watching.